I've never worked with kids who have autism, yet I know some of you live with a child who has this neurodevelopmental disorder, which affects their social skills, communication, and behavior. And it can also impact the way a child understands and relates to others. Selective eating and autism oftentimes go hand in hand. That's why I'm delighted to bring Rochelle Berry, the nutrition manager at the Children's Healthcare of Atlanta multidisciplinary feeding program, here on the show. She's a personal friend, colleague, and the first person I think of when it comes to eating problems with autism. For years, she's been working with children and teenagers who have developmental disabilities like autism and severe ADHD. She's also worked with other medical complexities, and these kids oftentimes have a diagnosis of ARFID, or avoidant restrictive food intake disorder. Rochelle's mission is to help more clinicians become skilled at working with children facing these challenges. And I can guarantee, as a listener, a parent who is a listener, you'll learn a lot about what it takes to help children with autism and selective eating. Rochelle, in this episode, shares her experiences and her unique approach to managing selective eaters with autism and how parents can nourish their children in the best way possible. In this episode, you're going to learn why children with autism are at such high risk for feeding disorders. You're going to also learn how Rochelle helps kids on the autism spectrum try new foods, how medication might play a role in the eating habits of children with autism, why a full gastrointestinal investigation could provide insight into the best diet for a child with autism. Rochelle will also let us in on some of the common nutritional deficiencies that she sees in her work, why not all behaviors and issues around food are directly related to a child's autism, and how you can get involved in a feeding program like what Rochelle provides in Atlanta. So let's not wait any longer. Here's Rochelle. I hope you enjoy this episode of The Nourish Child.
Welcome to the Nourish Child podcast, a show about childhood nutrition, feeding kids, and dealing with the ups and downs of growing a healthy child. Here's your host, registered dietitian and childhood nutrition expert, Jill Castle.
I'm glad to have you on the show. This is the first show I've ever done about nutrition and autism, and I couldn't think of a better person to have come on the show. You work in the field daily, and you're also a mom and a pediatric dietitian. Tell our audience sort of a little bit about yourself, your family, and where you do your work.
Well, I live in Atlanta, Georgia, and I started working in this field about 12 years ago at a place called the Marcus Autism Center. It's part of Children's Healthcare of Atlanta. And the goal of the Marcus Autism Center is to treat children with autism and all the comorbidities that come with autism, to do research in the field of autism, and also to really educate the community about how to work with children with autism. Specifically, I work in the feeding disorders program. So children with autism, as we're going to discuss today, are at a really high risk for feeding disorders or diagnosis of avoidant restrictive food intake disorder. And that usually manifests as food selectivity, insistence on eating the same food. So within the feeding disorders department, we help to teach children with autism how to eat new foods. We work on their unique nutritional needs. And then we also follow some children who are seen elsewhere in the building. Like I said, I've been working there for about 12 years. We've expanded our program to multiple locations within Children's Healthcare of Atlanta. And we don't only treat autism. We also treat children with other diagnoses of ARFID, including dependence on feeding tubes and things like that. But in the field of autism, we have about 3 primary dietitians who are working more specifically on autism. Other things about me, I am married to a lawyer in town, and I have a preteen and a teenager boy. So that has definitely helped to inform my life when working with children and sympathizing and empathizing with their parents.
Yeah, yeah. What drew you to work with children who have autism?
Yes, absolutely. So this is actually my second career. I had my degree in epidemiology and I was working at the American Cancer Society, and I just knew there was something, which was a wonderful place to work, and I knew there was something else for my life. So I went back to get my master's in nutrition and do a dietetic internship. And I had the good fortune of being placed at the Marcus Autism Center as part of my internship. And when I was working there, it just truly was like a light bulb. And I thought, this is where I'm meant to be. This is how I'm going to bring together everything that I'm passionate about. I'm passionate about working with kids. As my internship director said to me, you also have to decide if you're passionate about working with parents. And I am passionate about working with parents. And I just found in this population that, first of all, for children with autism, and really all children, but especially for children with autism, their parents are so dedicated to finding ways to improve the life and health of their children. And it's an honor and a pleasure to work with these parents. And then also from an interesting perspective, there's so many aspects of nutrition that can be useful for children with autism. They are at an increased nutritional risk for a number of different things. And so my intellectual curiosity, coupled with my desire to work with these children and their parents really came together. So I did the internship, and I really thought that the person who was in this job would never leave it, because who would? It's a wonderful job. And she ended up moving because her husband got another job, and there became an opening at the center. And she and I both kind of agreed that this was my calling and this is what I was meant to do.
That's awesome. I think so many people just in the field of nutrition, particularly around pediatric nutrition, definitely have a strong calling. There's something there that draws them to this area. Intellectual curiosity, I can totally empathize with that. I mean, there is never one child that's the same. Even if you have the same diagnosis, you're dealing with a myriad of different factors. Yeah, it's just a very fulfilling, wonderful area of nutrition to be in, I think. Let's dive into autism, and let's really specifically, I want to focus in on eating and nutrition. And how would you say that autism actually affects children's eating and their nutritional status?
Okay, great question. So when I think about autism and nutrition and eating, there are a few things that really come to mind that have to be considered when you're working with children. So the first one is going to be that food selectivity that we keep on talking about. And this is a fancy way of saying extreme picky eating, or really different variations in picky eating. This could be due to textures. It could be due to insistence on sameness. It could be due just for the need for routine. But in whatever the case, there is an insistence on eating only particular foods. Sometimes those foods can create a complete diet, and many times they cannot. So then thinking about, are there any nutritional deficiencies? Are there micronutrient deficiencies? So vitamin and mineral deficiencies? Are there potentially macronutrient deficiencies, such as decreased protein intake? So food selectivity is really going to be that very first thing that comes to mind when I think about nutrition and autism and eating in autism. The second thing I'm going to think about when I'm first meeting a child is there some sort of caregiver-mediated dietary restriction or manipulation that's occurring? Has the caregiver decided to take out certain foods or certain food groups in an attempt to alleviate symptoms of autism or to make their child feel better? Children with autism have impairments in communication. So it could be that a caregiver or another medical professional has considered taking out some certain foods to see what that would do. That as well can then lead to potential nutritional deficiencies in a child who might be removing those food groups on their own. Another thing I'm going to think about is medication. So children with autism might have concurrent diagnosis of ADHD, for example, and they might be taking a stimulant medication that is going to cause them to feel less hungry while they're on it. So they might need a meal plan that includes eating outside of the times that that medication is most effective to treat the ADHD. Children could also be on a medication like an atypical antipsychotic to help control some of the behaviors in autism, and that's going to lead to really increased caloric intake. So I want to think about that. What side effects from medications could be affecting this child's eating in a population that is more likely to be on these medications?
So let's talk about that a little bit. We hear a lot about the microbiome from just general healthy you and me. How might the microbiome be involved with autism, and what are the therapies that you're seeing as somebody who is, working with these children every day to address this?
So, well, preliminary research is showing us that the microbiome in children with autism is potentially different than the microbiome in typically developing children. The reasons for this are unclear at the moment, and I don't think we have, true causation figured out yet. This could be due to differences in eating. It could be due to differences in breastfeeding rates. It could be due to differences in birth, cesarean versus vaginal delivery. All of those things could potentially lead to different gut microbiota. As far as treatment goes, I haven't seen yet any evidence-based treatment that I would be universally using in this population. But that's not to say that that's not something that's going to be coming down the horizon. And I'm definitely seeing a lot more of that in the research. And it's something that our research lab at Marcus is considering as well. For right now, I'm really just continuing to recommend an overall healthy diet that includes foods, that are going to contain things like probiotics, such as yogurt and foods like that. So I'm not specifically treating the microbiome per se, but still very interested in seeing what is going to come out in the next few years.
What I'm hearing you say is there's no, clinical practice guidelines that are saying use probiotics with these children, or make sure you're offering prebiotic types of foods, fibers. You're not seeing any of that today.
No. I will say that if we have children who are presenting with a lot of GI issues, then we are considering whether or not adding probiotics. But no, not universally as a blanket statement for all children with autism.
You mentioned also that you're looking at sort of the parent modified diet, like whether parents are eliminating certain foods from their children's diet. And that's a concern of you, which makes me think about the gluten-free, casein-free diet, which has been around for over a decade, if not longer. And can you just give us an update on, is this an effective approach for children with autism? What are the downfalls? Is there any new science behind it? Where do we sit with the gluten-free, casein-free diet for autism?
Okay, so yes, this diet has been around maybe even 2 decades now, and it definitely is the most prevalent diet that I have heard of for treatment of autism as long as I've been working with this population. The current evidence does not recommend the gluten-free, casein-free diet overall for all children with autism. There have been numerous studies that have shown that it does not have an effect on the core symptoms of autism. And more importantly, the most recent studies have done a really good job that their participants are not people that would automatically respond to a gluten-free, casein-free diet, such as they have celiac disease or a wheat allergy, milk allergy, lactose intolerance. And what they have found is that when they compare a gluten-free, casein-free diet to a healthy diet of all the food groups, that there is no difference in the core symptomatology of autism. So I say that all with a big caveat to say that it is certainly reasonable to consider that some children with autism are going to react negatively to gluten and or casein, just like all children could potentially negatively react to gluten and or casein. So children with autism deserve a full GI workup. Are they potentially having any pain with eating certain foods? Are they having any allergic reactions? It could be that they're feeling something in their mouth or otherwise in their body that they're not able to tell us about. So when a parent comes to me and they are interested in the gluten-free, casein-free diet, I usually first review that same evidence that I reviewed initially, that the evidence does not currently suggest that this diet is going to quote unquote fix autism, if you will. But that if they're concerned that their child isn't feeling well or that they are having some sort of organic reason that they can't eat these foods, we should consider that. And then I also like to think about what is this child eating to start with. So if the child is only eating foods that contain gluten and casein, so breads, milks, yogurts, cheese, cereals, and then we were to potentially try to remove these, that child might not have anything to eat. And that would really be a problem. And it could be that that child is food selective enough or have, severe enough food selectivity that they're unwilling to then start eating other foods. Another downfall is that if the caregiver determines that they no longer want the child to be on the diet, the child might not then start to eat the foods that they used to eat again. So we're at risk for some nutritional deficiencies and really some overall weight and growth problems. So those are the main concerns that I have with the diet. But again, with the caveat that we should look at each child and see what is potentially occurring in their body.
Yeah. I mean, I think that there's just so much out there that circulates in the lay public. I've heard parents feel like their child's addicted to gluten and that's all they want because there's some, addiction process in the brain that makes them crave those foods. And that's why they're selective. I've heard, casein constipates children with autism. I'm sure you've heard all of this stuff too. It's very common conversation oftentimes around the topic of nutrition and autism. What I'm hearing you say is that you're looking at the research, but you're also being curious about the individual child and looking at sort of what's currently going on with that child, taking it from there. And I think you make a really good point about, removing items from the diet in a child that already may have a very restricted diet. Can we talk about some of the nutritional deficiencies that we're seeing? I remember you and I had a conversation a couple of years ago about a study around scurvy coming out. This case study was of a teenager who had severe ADHD or autism. I can't remember, but I remember us having a conversation and you saying, yeah, nutrient deficiencies are becoming a thing in this population. Can you expound on that a little bit?
Absolutely. So increasingly, we are seeing nutritional deficiencies that we would not expect to see in the United States or other developed countries. And these include scurvy, which is vitamin C deficiency, rickets, which is vitamin D deficiency. There have even been case reports of blindness from vitamin A deficiency, believe it or not. And what happens is when a child's diet is so restricted, it could be that it's restricted to the point that they are getting absolutely none of certain nutrients. So take vitamin C, for example. If a child is not eating any fruits and vegetables, drinking any type of fruit juice, not that I'm advocating for fruit juice, but it does contain vitamin C, and they are doing this day after day, week after week, and never having really any instances where they are going to get fruits or vegetables because they are refusing them completely, then they can develop scurvy quicker than you would think. And what we are finding when we look through the case report literature, and then what we've also seen in our own hospital system, is that these children will come into the ER, and typically it's that they're unwilling to bear weight on their legs. And this deficiency has gotten to the point that that's why they're coming into the emergency department. Another way that it's being diagnosed is in the dentist's office due to bleeding gums. So, say in the example that the child's admitted from the emergency room, they're refusing to bear weight on their legs. Otherwise, they're appearing relatively healthy. That is, they're gaining weight adequately, they're even potentially growing adequately. This doesn't make sense to the clinicians that are treating them because we're not used to seeing scurvy. This is nothing that we think we're going to see. And so what happens is that these children are then undergoing so many tests, potentially X-rays, MRIs, various blood work, all to try to determine why this child can't bear weight, because that doesn't make sense. And then when a diet history is finally taken and the dietitian takes a look at what this child's eating, suddenly the light bulbs go off. This child is getting no sources of vitamin C. And ultimately they're diagnosed with scurvy that can be corrected quite easily with some vitamin C supplementation. And what we're finding is that once we really start looking at children with autism or children with highly selective diets, and if we look at all of the food groups and determine what they are actually eating and whether or not they're eating any foods that are fortified with vitamins and minerals, you can see that there's going to be certain children that are going to be really at very high risk for nutritional deficiencies. And then if we run the lab work before symptoms have developed, we're catching it earlier and earlier in our clinics.
Mm-hmm. And then supplementing to correct. Yeah, I would imagine you're seeing higher rates of iron deficiency as well. For those of you out there who aren't sure what it means to bear weight, it means that the child just is refusing to stand up on his own, correct?
Correct. And refusing to
Yes.
walk. Mm-hmm.
Yes.
Yeah, we're seeing a lot of iron deficiency as well. So one reason could be that the child's drinking a lot of milk. And while milk is really good, too much of anything is too much. So if a child is drinking 2 to 3 cups of milk per day, that's wonderful. If they're drinking 8 to 10 cups of milk per day and not eating other foods, they're going to be at high risk for iron deficiency. Also, children that aren't getting any sources of proteins that contain iron,
And
potentially
zinc.
are not taking a multivitamin and zinc.
Mm-hmm.
So we're seeing that as well.
It's really so amazing. And I don't bring this up for the listeners out there to be super alarmed because, there are other children out there who have extreme picky eating, who have ARFID that don't have autism. But, it is a very real concern. And, we're talking about this so that you're aware that you're looking at your child day in and day out, and there are no fruits and there are no vegetables. There needs to be some supplementation on board so that you're not dealing with some of these longer term nutritional deficiencies. So, if we're talking about the struggles around eating for children with autism, we're talking about that food selectivity, the repetitive diet. They may be underweight, they may be overweight, which you talked about. Their growth could be altered as a result of, weight over time. Nutritional deficiencies. Let's dive into a little bit about food sensitivities. What are you seeing in that area? And I'm specifically sort of talking about food dyes and additives and things of that nature, even food allergies. What are you seeing in children with autism on that topic?
I will say I'm not seeing anything different than other children. What I am seeing is that clinicians can be really quick to label something that they're seeing in a child with autism as something that is quote unquote due to their autism. For example, if there's a behavior with a certain food, they might say, oh, well, they just have behaviors that we have to work on. And, we might see a behavioral therapist to work on the behaviors versus considering, is this something that is actually causing the child pain or discomfort or causing them to react a certain way? So I would say I'm less seeing that there's something different about children with autism and food allergy. It's more that we need to have a good lens at thinking about allergies and food sensitivities in children with autism and making sure that we're addressing them, we're getting them in to see the correct professionals, and that we're doing good dietary reviews and observations.
So, how would a parent get into your program? How a typical child and parent family that might find themselves on your doorstep?
Okay. Well, first, I would recommend that they talk to their pediatrician about their feeding difficulties. I do hear from parents sometimes that they're concerned that other medical professionals are not as concerned as they are about their child's feeding difficulty. But I would say coming in with a few things. So first, the parent should talk to the pediatrician about all the foods that the child is eating or is not eating, and make sure that they're highlighting that there's certain food groups that they're not eating at all. So then when they're ready to come into their program, I say first to go to the pediatrician because some children need a referral from a pediatrician. Otherwise, they can just call up. And what they're going to first get is a full evaluation by our entire team. And when I say entire team, I mean they're going to see a dietitian, they're going to see a behavioral psychologist, they're going to see a speech language pathologist or occupational therapist, and they're going to see a nurse practitioner or a gastroenterologist. And all of us together are going to take more of a holistic look at that child's feeding difficulties. We're going to be thinking about ruling out any medical reasons for the feeding difficulties, any swallowing difficulties, any function concerns. That's what the speech language pathologist is looking at. So once we've done that full team evaluation, we have a few different routes that you can go in for service. One would be that you really just need to see one of those disciplines that I've mentioned, and you can come in for regular outpatient services. These would be for children with more mild feeding difficulties, or if it's something that is more functional in nature, then that would be an option to do outpatient services. We also have some more parent guided types of interventions where we're teaching the parent how to introduce foods to the child. Again, this is going to be for more mild cases of feeding difficulties. Another option, which is really kind of our big program, is our intensive feeding program. This is typically an 8-week program. It's outpatient. It's 5 days per week, 4 feeding sessions per day or therapeutic meals per day. And that is going to be for children with autism who are highly food selective, have some very strong behaviors when non-preferred food is presented, and who we are worried about from a medical and nutritional point of view. And so if you're in that program, you are going to be seen by all of those disciplines that I mentioned, the behavioral psychologist, speech pathologist or occupational therapist, dietitian, physician. And in that program, we're going to work on slowly increasing the foods that we need that child to start eating so that we're no longer worried about them nutritionally. Again, that's an 8-week program. We have family area and space. We try to make it as pleasant for the family as possible. Some families stay at places like the Ronald McDonald House if we're too far from their home. And you're just going to be getting that comprehensive care at teaching your child how to eat new food.
This episode is brought to you by the Nourish Child, the ultimate nutrition school for parents who want to raise good eaters. Kids change a lot. Their nutrition needs, eating habits, and food preferences do too. So much so, it can be hard to keep up. The Nourish Child helps parents get crystal clear on raising healthy kids who are good eaters. We've cracked the code on nourishing the whole child, whether you're raising a baby, a teen, or a child with health concerns. You'll find free resources, guides, tutorials, and programs to help you get the inside scoop on food and nutrients, positive food parenting, and building self-motivated, autonomous kids who enjoy all foods. The Nourish Child builds you up with nutrition and feeding know-how so you can confidently raise a healthy, happy child. Visit thenourishchild.com today.
Like, what is that interaction like? Do you have similar foods at the meal that the child prefers, plus a new food? Like, how is that all executed?
Okay, I would say that treatment is really so individual for each patient, which is something that I think is really unique about our program. But for children with autism, a typical course of treatment would be first to look at their preferred food list. So, what are the foods that they're really willing to eat? And taking a look and seeing, are there any foods that are similar to that? Or is there some pattern that we're seeing? And could we find some foods that are going to fill in those nutritional holes that we're seeing that are still in that same group of foods that that child's willing to accept? So once we come up with a food list, sometimes we're able to do it based on those foods, and sometimes there's not a pattern and it's a little bit more of a guessing game. But then we're going to bring in the foods very, very slowly and in a small way. So it's going to be a piece of food that's the size of your fingernail, for example. And then once the child is able to eat that, they are going to get a break. They're going to maybe get to play with a toy, or they're maybe going to get to leave the room. And slowly we're going to increase the demand that that child is expected to do or expected to eat in order to get that same reward. And this is to really bring down their anxiety with this food. These foods can feel very scary to them. They don't even look like food to them. And so we're going to do that slowly in a way that causes that child the least amount of stress as possible. Once we start getting some momentum, we can typically then move more quickly with foods and bring them on in a way that the child is used to the routine. They know exactly what to expect. It's no longer scary or anxiety producing. And we're going to specifically target foods that are going to be nutritionally meaningful for that child's diet. So it's not that we're looking to make this child be able to eat any food ever. That is unlikely to occur. But can they be more flexible within the range of foods that they're willing to eat?
I remember we had a conversation about this a couple of years ago about meaningful nutrition for children who are selective eaters. And the philosophy that we both shared that it's not about getting them to eat whatever, matching textures. It's about helping them get a more nutritionally complete, sound diet on board. And that means tackling some of those really tough foods like protein foods or vegetables or fruits. Those can be the most challenging foods to help children learn to accept. What do you do when a child is really like losing it over that tiny little fingernail piece of vegetable that you're wanting them to eat?
Absolutely. So it could be that you've exhausted through all the vegetables and then you determine we're going to have to persist a little bit longer or maybe even up the reward. It could be also that we take a look at that food and say, is there a texture that we could make this food that makes it easier? Even could we mash or puree the food so that we're taking away that initial need to chew the food, because that's just another step in the eating process. Could we potentially combine it with another food? And I'm not suggesting in a way that we're hiding that it's a vegetable, but it would be really normal to mix up tomatoes and pasta, for example. And could we combine it with a food that they already are willing to eat to make it easier for that child to take that next leap to that food? If the child is verbal, and some of the children I work with are verbal and some are not, then I will come in with a few different options for foods, might even show them the foods in very small amounts so as not to overwhelm them from a sensory perspective, and say, we need to find a protein, for example, for you to eat, or we need to find a vegetable for you to eat. These are the options that I think you might like. Which one are you willing to try? And again, you're going to get to try it in a very small amount. If the child is verbal and I can get some buy-in from them that way, that is a great way to start getting some momentum with getting them to try it. And then there are certain foods that you try, and you realize this one just isn't meant to be. We need to try something else.
I always say to my parents, some foods are just never going to be liked, and that's okay. You probably have some too.
Absolutely. And then I should say, I work with behavioral psychologists that this is exactly what they're trained for. So we all work together as a team to determine what foods are we going to present, how are we going to present them, and how are we going to get them on board to complete this child's diet.
And it sounds like you're using a reward-based intervention.
The psychologists that I work with are trained in ABA. I wouldn't say that we have a strict ABA approach in that we're really doing a lot of that, what we would call in lingo, antecedent manipulation. That is changing what we're presenting, the food that we're presenting in a way that causes that child to have the lowest amount of stress as possible and be most likely to eat the food. But yes, they are using a reward in order, and oftentimes that reward is just a break and social interaction and playing with the person who's feeding them, because what they really want is for us to leave them alone and not put that demand on them. So getting a 30-second, 1 minute long, even 5-minute long break before they have to try again can be very rewarding within itself.
That's great. And I know that you presented at a meeting some of your outcomes data, correct?
So about a year or two ago, we conducted a year-long study looking at a manual called Meal Plan, which was an outpatient intervention designed to increase variety and just better mealtime interactions for children with autism. This intervention was designed by behavioral psychologists and nutritionists, and with the goal of really making meals more pleasant in the home. So we did 5 different groups of meal plan, and we compared it to parents who were just receiving some basic parenting tools specifically designed for children with autism to see if there was something different about this meal plan program. Could we increase food variety in an outpatient setting? And also this program is only 10 weeks long, so in a 10-week period. So here I've told you some about our intensive day treatment program where we're getting 4 meals per day, 8 weeks, and obviously that's a really big deal to come in for that. Could we do something like this on an outpatient basis for children who were more mild or moderate with their food selectivity and had parents who wanted to be doing things at home and were willing to be trained to do things at home? We had some great outcomes from this. So first of all, parents really liked it. They liked the program. They felt they came every week, which tells me that they really liked the program and that they found value in it, and they were willing to do the homework. Also, they bought into what we were talking about before about introducing nutritionally meaningful foods. So not just giving a different type of bread or a different type of cereal, but targeting chicken, for example, if the child wasn't eating any proteins, or targeting a vegetable if the child wasn't eating any vegetables. So they were willing to go to those harder foods that potentially would have felt like really a mountain to overcome previously.
I think it's great because, you and I have talked about this before. I work with kids with extreme picky eating too, but they don't have autism. They're picky eating, mental health related, anxiety disorder, that sort of stuff. And, I think helping them broaden their diet in a way that is pressure free, that they can feel good about and doesn't add to their stress levels, their anxiety, all of those things that would be counterproductive, is so important. And to actually have, a system, a routine, a studied approach that you do. So as we wrap this show up, what practical advice would you give to parents or even healthcare providers about feeding children with autism?
So there's a few things that I would say. So first, I would make sure that when we're thinking about feeding children with autism and the nutrition in children with autism, I want to make sure that we're not just looking at weight gain and growth as indicators that all is well in the world, and that we're taking a look at exactly what is in that child's diet, even if we just go through each food group one by one and make sure that the child has a few foods in each food group. And if not, consider if there's a need for therapy. Another thing is I would make sure we're not falling into the trap that we fall into with all children and really a lot of adults of eating the same food every day. Making sure that we're not helping this child to be more rigid in their diet just by mere fact of not serving different foods. Paying attention to side effects with medications, as I mentioned at the top of the show, and thinking about as medications are potentially prescribed for behavioral difficulties, that if there's any appetite issues that occur as side effects with the medication, that we're paying attention to it. I'm also going to want to look at the use of edible reinforcers. We didn't even talk about this during the show. I neglected to bring it up, but sometimes for children with autism in their everyday schooling or therapy, foods, and specifically snack foods, dessert foods, are used to praise behavior. So considering whether or not that's in that child's diet, and we need to look at how much that kid's getting in a day, and is that potentially negatively contributing to their nutrition.
Mm-hmm. Or interfering with their progress.
Exactly. Really interfering with their nutrition. And lastly, making sure that children with autism are getting plenty of activity. They might not be as likely to participate in team sports. They might not want to. They might feel uncomfortable, or there might not be different leagues that are as inclusive for children with autism, but making sure that they're still playing nonetheless. And then they're getting outside and they're getting that routine exercise that we want all children to get. Really making sure that we're doing for our children with autism exactly what we're doing for our typically developing children, making sure they're getting good nutrition, that it feels good in their bellies, that they're running around, and that they're getting everything they need to grow and develop properly.
Good advice. If you were to just make your wish list around nutrition and autism, what would that wish list be? What would you love to see change for that population of children?
I would love to see more dietitians who are trained in how to work with children with autism, that they're trained to recognize that children with autism are going to have unique nutritional needs and what those unique nutritional needs are. And as children are diagnosed with autism, they also will then have a nutrition evaluation to make sure that we're addressing all of these nutrition needs for children.
Mm-hmm. I feel like it's a little bit of a lost population, like in the nutrition world. I mean, we know there's lots of interactions and potential risk there with nutrition and with eating, but I'm with you. I'd love to see more nutrition professionals get into the realm of autism and treating children with autism, because I feel like it's a little bit of a lost sector. Little attention to the nutrition gets brought up.
Absolutely. And caregivers and parents, they're seeking this information out. And that's also to say that children with autism are just as likely to be diagnosed with food allergy, for example, or type 1 diabetes, or any of these conditions that would require a change to diet. So having information, extra schooling, extra education for then how to work with the child with autism, so that you know about food selectivity, you know about caregiver mediated dietary restriction, because these will all inform then how you're going to treat the type 1 diabetes, for example.
Mm-hmm. Can you comment on just the general internet and computer-based learning and information that many parents are getting for their children with autism? Are they finding information from the right places?
Definitely not always.
Yeah.
I would say it is really important to think about a few things. So one, does that person have the training to be saying what they're saying? And do they have the information that is coming from evidence-based sources and that won't potentially harm that child if they don't have that information? The other thing is there are a lot of people out there and organizations out there that charge a lot of money for unproven treatments. So I always like to talk to parents. If someone's asking for a lot of money for something, then you need to beware, because some of the less sexy interventions don't cost as much money, but are much more strongly based in evidence.
What good resources would you recommend in addition to the Marcus Center where you're at? And I do want you to share how people can get in touch with you, but do you have any other resources, trusted resources that you would share with parents?
I think a place to start would be Autism Speaks. That's a website that you can go to and you can find various information. You can find various practitioners through that website. That is a good place where I would start.
Okay, awesome. And how can people connect with you if they want to follow up after the show?
Absolutely. So I'm at Children's Healthcare of Atlanta. The Marcus Autism Center is part of Children's Healthcare of Atlanta. Our main phone number to contact the Marcus Autism Center is 404-785-9400, or they can reach out to me, Rochelle Berry, which is Rochelle, RASHELLE .Berry, BERRY, at CHOA.org, and I would love to hear from you.
Awesome. Rochelle, thank you so much for sharing your expertise and your time here on the show.
Thanks for listening to this episode of The Nourish Child. Now here's what I want you to do next. If you haven't grabbed my free checklist, How to Nourish a Child, head over to www.thenourishchild.com and click on the show notes for this episode. This checklist is designed to give you a clear path and the steps you need to take to raise a nourished child inside and out. Also, if you love the show, I'd love for you to rate and leave a review on Apple Podcasts. Not only will this give the nourished child a boost, it will also help other parents find it. Now, let's wrap this up. I'm Jill Castle, and until next time, give that child in your life a loving squeeze today. Bye for now.
Thanks for listening to the Nourish Child podcast, where the #1 goal is to help you grow a nourished child inside and out.